Today we're here at Clinique Le Avons, second location in Royalmount, to discuss one of the biggest shifts currently happening in weight loss management, the rapid rise of GLP-1 medications. We will explore how this evolution is changing the way we approach patient care, tissue quality, and the solutions available to support patient journey. I'm here with Dr. Mirko Gilardino, board-certified plastic surgeon, owner and medical director of Clinique Le Avons. Dr. Gilardino, we're here together at your second location, Le Avons, at the Royalmount.
It's a pleasure to welcome you here this morning.
Thank you for having me. We want to have a fun conversation today about a topic that everybody talks about, GLP-1. I'd love to hear your input about how this GLP-1 medication has changed the scope of aesthetic medicine.
So, because of how prevalent GLP-1s are now in society and weight loss management, I would say it feels like about 25 to even 30% of patients have either been on them or are on them presently. And what that means is that we're seeing much more rapid skin weight loss changes. And because of that, we have to adapt our strategies on how we manage those patients because their skin is different.
That's right. I was present at your event that you handled a few months ago with Dr.
Yes.
That's right, with Dr. Andreas, with your patients. And that is where the whole bulb light up for me. Is like, this is a real topic. You were talking mainly about face. There's a lot of questions from the audience about face and body. And this is how we started the conversation together. And at the time, you were looking for something in order to complete your practice towards these patients. How was your process?
Well, look, for sure when we talk about patients who've lost weight, whether it's with GLP-1s or other methods where there's been a rapid weight loss, it's not just the fat loss that's a problem. It's the quality of the skin that's a problem. So traditionally, we look to energy devices. I'm sure you've heard of many different lasers, microneedling technologies. You're also hearing a lot about biostimulators, which are injectables which stimulate a bit of collagen in the skin. What I do see is that patients are also looking for completely natural ways of doing things. They don't necessarily want the energy or the injectables. And in that light, we're starting to look at certain other modalities, such as LPG, which is a form, as you know, of mechano-biostimulation of the skin.
I know it took you some time. You were doing so much research. But you were familiar with Endermologie, I believe.
Yeah, it's been around for a long time, and as you know, it comes from France, and it's a technology that they've used for all kinds of recovery from surgery, improving body contouring and stuff like that. What's interesting is that when you look at the field, what does it mean? What are you doing? Well, it's really, endermology describes a technique where you're using mechanical stimulation of the skin,
which is called today mechanomedicine.
Exactly. It's got its own name as a field.
Yes.
And it's causing changes in tissue biology. So how does that even work? Well, if you think about it, the fibroblasts, which are a critical part of the skin, deposit collagen. We all know collagen is something we lose as we age, and definitely as we lose weight quickly. So by stimulating mechanically not only the skin but the deeper tissues, you're doing a plethora of things. Not only are you increasing collagen content, but you're improving vascularity, getting rid of inflammation and edema. It penetrates deeper. So it's interesting that it's actually a technology that does more than just skin, as I would say.
Exactly. And to your point, when I speak to a lot of clinics, physicians in my field, this is what we do. They cannot grasp the difference, really, some of them, but now more and more, because there is a shift towards longevity, wellness, well-being, inflammation. And how is this compared to, you were mentioning energy-based? What is the real difference between the two? And that is something that we always come across.
So I think by starting, we can say there's really a role for lasers, energy devices, microneedling. But those really do affect the superficial layers, and they really are effective at targeting collagen deposition in those superficial layers. You said a key word there, wellness. Actually, you said two words, wellness and longevity. We're seeing more people coming in not only for their aesthetic needs, but their wellness needs. So we're talking now of hormones with patients. We're talking weight loss with patients. We're not just talking surgery and or lasers and injectables. And what's interesting about LPG is it's a treatment that doesn't just target the skin, as I said. It really penetrates deeper. So for patients that feel chronic inflammation or pain in their neck and back regions, this is a technology that happens to improve those things. So it really falls into, I would call it a synergy between aesthetic improvement and functional/wellness improvements.
Amazing. And your patients are experiencing it right now in your pre-post procedures along with the non-invasive procedures. But the interesting thing about your clinic, Le Sazvan, is you're combining also hormonal therapy, I believe, and multiple things.
So we use this in a number of different ways. For sure, we use it to help improve results from surgery. It helps, especially when you're doing body contouring, any type of liposuction-based procedure. It gets rid of that edema, it helps with pain control, even the scar. So we love it for that. I love it for my facelift patients because when you have, at the 2-3 week phase, that edema is just not getting better quickly. Patients love it, and the thing about it is they continue to do it because they like it. They really love the way it makes them feel, and it's a comfortable treatment, so that we know. Where it's getting exciting now is that as we know, we're seeing all these patients that are coming in for consultations with one of our physicians who talks about weight loss with them. Well, we don't just stop there. We start talking to them about their hormonal balance. How can we optimize their skin, their body, how they feel? And I like to get them going on LPG before they even start that. Why? Because I want to stimulate that biology change early. I want them to feel good. And as they start to lose weight, we're there to control their body weight loss. So they're not losing too much weight because otherwise the skin looks terrible and we can't catch up. But if we can control their body weight loss and we can incorporate technologies like LPG during their weight loss and then a little bit of maintenance afterwards, we're seeing better results, and probably even if they need surgery, their skin's in much better shape.
That is such a, I would say, advanced way to seeing those patients. I came across a lot of patients and they tell me, I lost so much weight. If I knew my skin would look like that, I wouldn't have done it. But I think what's lacking, it's not the weight loss that is problematic, is the prise en charge, like we say.
Counseling.
It's the counseling and the taking care of the before. So to make it for everybody to understand really your concept in what you're doing right now and what you're preaching is more before, during the process, and after, with multiple ways to tackle that for the GLP-1 patients.
My favorite is when we are the ones that start a patient on a GLP-1. Why? Because we're there to tell them about all the things they need to know, not only their nutritional status and possible muscle weight loss issues. And so instead of them coming to me with skin that's totally loose, in bad shape, their fat is not in great shape, and when you lose all that weight, I don't think your circulation catches up, so they start to get edema in funny places. If we start treatments of all kinds, whether it's hormone, weight loss, LPG, all the things like that, ahead of the game, what we just see is a more gradual, improved style of weight loss. And I think they feel better too, which is critical.
Which makes complete sense. You don't want to wait, and probably they think the only solution is surgery.
Well, that's the old way of thinking of it. And that's why I would like to say that what I love about wellness, of course, it's a huge field now, but for me, it incorporates the holistic aspects of aesthetics that we should be doing. We should be talking to people about how to optimize the results, not only afterwards, before.
Amazing. Well, I'd love to be your patient.
Well, you're welcome anytime. It's a pleasure to chat with you anytime.
Same here. Thank you so much for
your time. Have a great day.
You too.